This morning we continue our four-part series on improving health care for you and your family with the help of your pharmacist. It's part 3 in the series, and today we're talking about managing diabetes. Diabetes Alert Day is in March, and a lot of pharmacists today are specialists in managing diabetes. Here to explain is Carl Aquaviva from Good Neighbor Pharmacy, a network of more than 3,000 locally owned community pharmacies. Welcome, Carl.
Thanks for having me. It's my pleasure.
You know, let's talk about the idea of pharmacists are really someone you see much more than your doctor. You probably see your pharmacist 3 or 4 times a month.
That's correct. With the multiple medications that diabetics have to take, the testing that's required of diabetics, we may see a diabetic patient 2 or 3 times a month, whereas they may only be able to see their doctor 2 or 3 times a year.
And what is the best advice that you could give as a pharmacist coming in to your patients that come in and want to talk to you?
I believe obviously we're part of the healthcare team, and I think that the pharmacist plays a role in reassuring the patient on what the doctor has told them. Many times you go into the doctor's office and it's such a busy place, and the doctor's in and out so quickly, and they give you a lot of information in a short period of time. It's nice to be able to come into the pharmacist where we know your name, you're our customer, our patient, our friend, and you're in an atmosphere that's not as threatening as the doctor's office, and we're able to, like I said, reassure the patient that it's very important to do all of these things that the doctor has just told them to do. So
what I love about your particular pharmacy is that you are, like you say, interactive, and if I came in with a prescription sheet, you could kind of decode it for me, right? That doesn't happen at all pharmacies.
Absolutely, absolutely. When you come to our pharmacy, we'll fill your prescription, obviously, but we'll make sure that we give you an opportunity to ask questions, and that by the time you leave our pharmacy, you'll know exactly what that drug's for, how you're supposed to take it, and look for any possible side effects that might occur.
Now, I know at your pharmacy, and there are 3,000 of them across this country, that if someone comes in and wants to monitor blood sugar, you've got advice and help on that, but you also do a lot of other testing and offer different services.
We sure do. We offer flu shots, which is very important for a diabetic to get a flu shot every year. We have other immunizations that we offer, Zostavax, the shingles vaccine. We also do cholesterol screening, which is very important for a diabetic to check their cholesterol on a regular basis. We have what we call meter days, where the diabetic will be able to bring in their machine. We'll go over it with them. We'll usually bring a company sponsor. It's a company-sponsored event where one of their representatives will come in, show them how to clean their machine, what they need to look for when the machine might be malfunctioning, so that way their testing is accurate, that when they do their test, they know that the results they're getting are correct.
That's really important.
Yes, it is. Yes,
and of course, type 2 diabetes may be prevented, but at least delayed, right?
Oh, most definitely. With following a good regimen of exercise and diet. And I believe every diabetic should probably have some sort of nutritional counseling too, because it's we are what we eat as far as that goes. And it's very important that they do follow a pretty strict diet when you become a diabetic, because you want to be able to lessen the effects of what diabetes can do to you on a long-term basis.
You know, my grandfather died from complications of diabetes, and I wish he had had Good Neighbor Pharmacies or someone like you, because he felt very removed. I mean, his pharmacist was way back. You couldn't really talk to. He didn't, you can get hard to get through to your doctor, but that's something you really value, is that you're upfront, you're able to talk to your patients that come in.
We like to think we remove a lot of those barriers, that that makes it more comfortable for the patient to talk to us, for the patient to bring questions to us, to make sure that they are testing properly, that they're taking their medication properly, checking their feet every month, going to the eye doctor at least twice a year. Those are very important things for a diabetic to keep track of. And we like to think we get rid of those barriers so that it makes it easier for them to do all that stuff.
I was going to say, unlike a doctor, you don't have to make an appointment. You can just walk in and see you, right?
Exactly, exactly. You can walk into our pharmacy, and usually you'll have an answer to your question within minutes.
Wonderful. Carl, thanks. Great information. So glad to have you on the show today.
Thank you for having me.
Want to learn more? Log on to thebalancingact.com. You can also follow us on Facebook and Twitter. We might just share your tweet on a future show.